welcome to an episode of TooHealthTalk. A show we get to talk about health challenges and get to break it down in a very simple and honest conversation. On today, we're going to twist today's episode because we're having something very special. Like we're having a very special guest that is going to share her story, and I so much believe that her story is going to inspire so many people that are looking up to that profession. On today's episode, we have nurse Ife Christie. Welcome, nurse.
Thank you. Hi, everybody.
How are you doing?
I'm very well, thank you.
It's so nice that you're here today. I'm very excited that you find out time in your busy schedule to come to the show.
Yeah, baby.
So now, like nurses are like one of the backbones of hospitals,
Mm-hmm.
and like it's one of the most stressful profession out there.
Yeah.
So, like, what actually inspired you to become a nurse?
I think that's a question everybody gets as a nurse. One way or the other. But left to me, the very first thing I would think I saw and made me decide to be a nurse is because of the stability. I feel we have more job stability when it comes to my profession, knowing fully well the professional job. Then another thing that I will be sincere about is the fact that while growing up, my granddad was a nurse.
Oh wow,
Yeah, my mom, she's a nurse, like an apex CNO now in one of the hospitals in Oyo State, Ibadan. Then my immediate brother is in the US, is a nurse. Then I'm a nurse, and some of my cousins as well, they are nurses. I just feel family background aside, where you grew up, where like you saw your parents doing this and you saw the stability it gave them as a then. That was my mentality, and I feel that was why I chose nursing. A lot of people will be like, okay, to care for people, fine. It is part of my job, it's secondary responsibility. But the primary reason I chose nursing is for the job stability. And so sad, Nigeria is not giving us the financial aspect. But then, don't worry, we're doing something.
yeah. So you, like you said, I noted it down. You said as a then, so you had that like feeling that nursing was like one of the best thing after jollof rice.
Yeah,
So what happened now? Like what's actually happened?
a lot of things changed. When you actually have the opportunity to experience the four corners of the profession,
Yeah.
at least to an extent. Post graduation, I'm 3 years post graduation, so at least to an extent, I've worked. I have 2 years experience in active practicing, but then by the time you invest into it and see yourself actively working
Yeah.
in hospital setting, a whole lot of things will change, and that is the truth.
Like what? So like what's this when you started working in a hospital? Like what's the atmosphere like? This one you're already saying a lot of things will change when you work in a hospital.
Well, when I started working, I was so happy starting, I was so happy practicing, like when I wanted to start. So, the burnout, a lot of new graduates, they don't expect the burnout. There's burnout, stress, like the way Nigeria sets in, hospital setting will suck you, they will suck your intelligence, your time. And if care is not taken, you see you're investing into another man's dream rather yours. Do you understand? A lot of people don't see it that way. Left to me, I believe in investment. You invest in yourself. So as time goes on, when you practice, but at the same time, invest in yourself. So that is what I would say. So I had a very major experience while working, while practicing. So it made me just, for now, signing out.
So what's the experience? Can you share with us like which experience that you had that made you want to leave practicing nursing? Bedside nursing, I mean.
So as a result of poor staff welfareism, something related. Do you want me to go into the
I want you to
story?
be into this.
Well, my story is so funny.
Don't be scared though. This one already down. I say it. Oh, are you emotional about your past
Yeah,
experience?
it's traumatic actually.
It's traumatic.
Yeah,
Wow.
kind of traumatic. Okay, this was what happened. I had 24-hour shift prior the day.
Yeah.
So the next day I needed to cover my shift. It wasn't my shift that I covered the day prior. So I covered my shift. Then I was done. I was rounding up already, clocking out. So I was just going home. Then at the entrance of the hospital, one of the ward aides called my attention that there's a patient at the emergency room, but everybody was busy. If you know my former place of work, it's a very busy organization. So, now, young nurse, on a normal day, a lot of nurses wouldn't come back. I clocked out already, it's not my work. So I went back, I saw the man, I approached him, clapped him, and you understand, I checked his profile, what's it called, his record.
Yeah.
Then I saw, oh, it's just fever and little headache, malaria in short. He had test already. So I checked his, what's it called, the prescription the doctor gave. So it was antipyretic. So I just ordered for the drug from the pharmacy and it was done. So on administration, I told him, oh, this is what use normal nursing procedure. So I administered the medication and on withdrawing my cannula, unfortunately it was an IV medication, and on withdrawing the cannula, discarding in a safety box, I had a needle prick.
Wow.
So the patient noticed. Then I explained to him that, oh, sorry, sir, I have a needle prick, but I need to inform a colleague of mine. Please hold on, because there's a procedure to that. We have standard of procedure. Do you understand?
Yeah.
So on going to the emergency room, informing my superior, then we going back to the injection room, the patient vanished.
Wow.
Like he disappeared. I was, I was. Just imagine everything, like everything you'd be thinking of. So, fortunately for me, there's a doctor beside me. So he was like, "Oh, what happened?" I explained to him. Then he was like, "We have to escalate this." So we told my matron, my manager, sorry. So I'm telling my manager, the very first thing she would say was, "Oh, why were you so careless? I'm very sure you were distracted doing something else. Why
Wow.
doing this?" I was shocked. Now I know my profession is something else, but at this time I was not expecting this. Then I was expecting a step to be taken. Is it for you to take me to the lab, run a test, or give me post-exposure prophylaxis? I remember I had my hepatitis vaccine already, so that doesn't really concern me with the hepatitis. But for the HIV, we are in Abuja, for goodness sake.
True.
So people were so nonchalant about it. So I needed to like be very adamant on the hospital management. So we called the MD, and then the very first statement he would make was, "Who will cover for the hospital bills?" Like the laboratory investigation, just to
Wow.
have me tested. The patient ran away already. So that is, he might even be in his window period. Do you understand?
Yeah.
So what if it was negative at that time, but it was in his window period? So I just had to care for myself. The later gave me the post-exposure prophylaxis, which I started, and that was where the old drama really started, because the drug, I don't know if you know the medication, it is another ball game entirely. So I started, then you take it for a month, same time, 12 hourly, same time in the morning, then in the night again.
Wow.
So I was taking the medication, a whole lot of side effects, insomnia, the times hallucination, your mind will be playing games with you. So then the matron called me one day, "Hello, you have to come to the hospital, nobody's covering your shift. Why taking post ex? No. So that was what made me cut it off.
So now you've blacked out like totally of practicing nursing.
Um, I actually finished the medication and I resumed back to the same place. But then I knew I'm not staying here for so long. So months later, I had to resign. Then on resignation, I'm furthering my education as at now. I'm
Yeah.
running a program. And at the same time, I have businesses I'm involved in. So
Oh.
for now, I think self-investment. So
So now you're saying that, oh, that particular experience like gave you like a red flag
yeah, that was the
for
highlight.
practicing nursing.
That was the highlight.
Do you think like other hospitals are like that? Have you tried other hospitals? Have you like maybe make inquiries, ask your colleagues that, oh, is it a Nigerian thing that nurses are not taken care of?
Nigerian.
Wow.
It's
So
even better in my former place of work. Imagine if it had happened in a public hospital, or this PHC. You might not even get the laboratory test done. I don't know.
wow. So like now you're saying that your passion for nursing is dead.
Come in there.
Are you saying your passion for nursing is dead?
Not dead. I'm furthering my education, still in nursing.
Oh, you're still in nursing?
Yeah.
Oh, wow. So you probably might still go back to bedside
I'm
nursing now.
like, no, I'm not going back to bedside.
So what's the plan for nursing?
Furthering my education, at least having this. I told
Then
you it's for
after
job stability, not for the passion
so-
to gear. That's the sincere truth. It started with job stability. Do you understand?
Yeah.
But now I practice to an extent, and have my experience that I want in bedside. So I can decide to go into education, not educator. Do you understand?
Yeah.
Aside bedside, but when it comes to bedside, no, I'm done.
Were they meant during that phase? Were they like a mental health like challenges
Yeah,
you
it
were
affected
having?
my mental health. I told you
So
hallucination. I was
so how
hallucinating.
were you able to handle that phase?
Our friends, remember, I have my family is medical, what's it called? So they actually helped me, and I have a doctor friend in the same facility. So he actually helped me with that.
So what's your advice now to someone that wants to go into nursing?
Please do.
Hey,
Yeah,
with this experience, I
I'm a
saying they
proud
should still.
registered nurse. From now till tomorrow, I'll still be referred to as a registered nurse. We have workplace hazard. Do you understand? But the what's it called? The response to what happened, that was what really affected me. It is normal. Those are the things that you experience. But then, if you really want to practice nursing, please do. It is a beautiful course. It's a noble profession, but have reasons before you involve yourself into it. Because if you go there because of the caring for the patient, I feel that would be what will frustrate you out of it. If care is not taken, yes. If you are not really compassionate, if you don't really have the passion, and you venture into it, you'll be frustrated out of it.
Were you almost frustrated, like out in total, not just like what that particular incident happened
In
to you?
bedside nursing, I was frustrated. I'm a
Wow.
mental health nurse at the same time, don't forget.
Yeah, true. I remember that. Yeah.
So the bedside, I don't know if you understand bedside nursing.
Yeah.
This is where you give complete holistic care. Do you get me?
Yeah.
So, but we have other part of nursing. We have a nurse as an educator. We have cosmetic nurses. We have psychiatric nurses. We have midwives. We have a whole lot of things. So you really want to decide on which you want to do.
So now, do you think this is a nursing problem or general? Because for example, now I can say like me personally from my own experience, I can say, oh, they treat doctors like more of respect than nurses. Like sincerely, I'm being so frank with you.
Can you
Like there's
explain the
a
respect?
see, like there's a lot of rep if you're a doctor, there's a lot of rep for you than nurses. Even for example now, you see you see for example now you see a lady wearing scrub
Yeah.
and the lady is a doctor, you call her nurse.
Misconceptions,
First of all, they already pick offense that, oh, why calling me a nurse?
of
Like
course.
I've been working with one of my doctor friend and someone called her a nurse and she got so pissed off, like, don't call
Of
me a
course, I
nurse.
will.
So now, if any problem that will solve
My
today now,
estate security at home, when they see me wearing scrub,
they call you
they
what? Yeah.
call me doctor. And I tell them I'm a nurse.
No, maybe because of, I don't know, but mostly people, anybody wearing scrub is a nurse. So basically, most of it, like, bad reviews, like, that's most all the fight that they fight, they prefer to fight with a nurse than a doctor. So do
Okay.
you think it's a Nigerian thing or like it's something like general?
I feel it's a Nigerian thing. A lot of people are not well informed. A nurse has is a function. A medical officer as is our function. Do you understand? A pharmacist, they have their responsibility. So I believe when everybody understands this is my role and my responsibility, then there wouldn't be misconception. Do you understand? So I just feel that is the best answer that I can give to that.
So you think, oh, they treat both nurses and doctor equally?
Equally, no, we have see that topic that subject now is another conversation on its own. Do you understand? But left to me, I appreciate it when you call me what I am. Do you
Oh,
understand?
yeah.
My security call me doctors. I'll be like, no, I'm not a doctor. I'm a registered nurse. Call me nurses, and they are always shocked. Truth be told, for me to say, oh, I am not a doctor. I am a nurse. Do you understand? So I believe I've never dreamt becoming a medical officer. No, I have never, sincerely. I have never. If I wanted to and I found myself in nursing, believe me, I will go for that medicine.
Wow.
Yeah.
So now let's talk about let's go back to your past experience, like with your former work of place
Yeah.
that made you to leave nursing.
Okay.
Now, if you are going to sit down with a
Made me to
management
leave bedside
bedside
nursing.
nursing, sorry. Now, if you are going to sit down with a manager, like someone that manages a hospital,
Okay.
like what's one advice would you advise the person about taking care of the nurses?
Well, we're only short staffed. That's in every facility. They're always staffed.
for nurses?
Yes, I don't know. That thing is like a pandemic. They're always short staffed, and we actually have graduate nurses outside. Do you understand?
Yeah.
So I would advise someone in managerial position have maybe like a weekly, what's it called? A weekly, we call it, sorry, can you lend me the English? There's something we call it, whereby they call staffs and they do something like an audit. I don't know if you understand.
Yeah, I guess maybe weekly meeting or orientation or something like
Yeah,
that.
maybe every Wednesday. So everybody can come together and see what they notice. But you should be a good listener as a manager, first things first. We have a lot of managers that they really do not listen. And it is very, very common in Nigerian setting. When I call my friends that they've attained some managerial position, maybe NHS in UK or something, the way they approach their staffs and treat their staff is quite different. So I feel it's more of a Nigerian thing.
Oh,
Yeah, a lot of people get to that managerial position without proper examination. They just feel, oh, I've been working in this place for 10 years, so I feel I have the experience to manage this set of people, which is wrong.
do you think they like in general now? Let's go to general in Nigeria as a whole. Now, do you think that like there's a way that they treat nurses that you, if you have the power to change, you would change it?
We start from the curriculum in school.
How is it?
We start from the curriculum in school.
How is it like?
Let's take it that way.
Okay, after apart from curriculum, what else?
Yeah, the education. I think I'll focus more on the education aspect because it is very bitter and very sad. You see a graduate 5 years in school, then on graduation you will be seeking and begging for internship.
Wow.
Is people are really really suffering from that thing right now. So that people will wait for a year or a year plus to run their internship, which means the education sector is very, 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 very wrong. So we have to start from the curriculum first. Is that time they scrape school of nursing and let everybody focus in going to university, having their BNSC, if I'm correct. Do you
Yeah.
understand?
Yeah.
So we start from that, scrape school of nursing, school of whatsoever. Let's go straight. Enough of diplomas. We are professionals. So I feel those are the things that causes segregation at times. You were talking about nurses and doctors. Voila. If I spent 3 years in school and you are spending 5 years in school and we graduating and we aren't mates. Do you understand?
True.
I came out with RN and you are coming out with RM, public health and BN. Are they the same?
No.
They are not. So you understand. So I feel like we should go back to the basics. Let's go back to that curriculum, the way they organized it, and change
So
everything.
you now say, well, I thought I was asking someone this stuff. She said she was going to first of all increase nurses' salary, that maybe or that nurses are not paid well
The
or something.
remuneration is poor. See, when you asked me why I became a nurse, I actually did not want to say because of the money. Because the money, no, don't let us go. If it's about the money, no, it is not about the money because how much are they paying? But considering going outside, there's this stability. I'm not even talking about Nigeria now. When you travel out, there's job stability, there's job security. Do you understand? Compared to Nigeria, how much?
I see nurses driving Benz now, big
Oh.
cars. So maybe outside the
How
country,
many doctors, nurses, pharmacists are living that luxurious life?
maybe outside of the country, I think nurses
Outside of the country, thank you. So that means there isn't that stability. Like the money is not even there. How many nurses are living a luxurious life? How many of them can sponsor a vacation, like with Nigerian government salary?
So nurses cannot sponsor vacation.
No, that is the reason you have to have a side also. A medical doctor can sponsor a vacation. Do you think?
Maybe most of
Can you
my
be earning 500K and your girlfriend is requesting for a bone straight of
I
800,000?
don't have a girlfriend, so I don't know.
Okay, that's a you problem. Do you understand?
Yeah.
I personally, I logged out of nursing bedside because of the money saved in addition. Because I cannot be working in 9 to 5 and be earning peanuts at the end of the month. And no, we run something else.
So lastly, before we go, in your next life, will you choose nursing?
There's this meme I saw on TikTok, and someone said, "Na poor man picking they study nursing and medicine."
Wow.
Like, do you understand? Yeah, actually coming from it, you won't study nursing. You won't study medicine, no. How many of them are studying medicine?
Wow.
They play.
So you're not going to study nursing in your next life?
My next life, no,
No.
yeah, I would want to explore other specialties like
Okay.
economics, finances, something like that. Yeah.
So I want to like thank you for creating our time for coming on the show. Like it's actually mean a lot to me and
Thank you.
to all of us at TooHealthTalk. We want to say thank you for coming on the show.
Thank
So
you.
I know so many people watching this stuff now. I don't know if there's a mixed feeling if they are going to study nursing or they are not going to study nursing.
Please, if nursing is your calling,
Yeah.
please do. If medicine is your calling, study medicine. If it's pharmacy, study pharmacy. You shouldn't want to be in the four corners of the hospital. Study anything that will make you be in the four corners of the hospital, caring for people. Some people are inborn nurses. Some people, they have the passion to care, to render care for humanity.
Yeah.
But we have care comes in diverse
But
ways.
you don't have that passion again.
To care for the sick in the hospital. No.
You don't have that passion.
We have different. Don't get me. Can we? Sorry. Can we cut this thing? Don't
I
get.
like this part.
Wait. Don't get me wrong. Do not get me wrong. I mean, you can be in the four corners of your room
Yeah.
rendering care for someone,
Yeah.
but the physical having contact with patient vibe,
Yeah.
that is what I am out of, and I feel is nothing bad.
It's actually sad that we've lost one of the best nurses.
You did not lose.
in bedside nursing. Like,
You did not.
it's actually
In
very,
bedside.
yeah. It's sad that we've lost because
No, a whole lot of people are still coming in. Don't worry.
but you know now, there's this saying that they say that you're a Christian, right?
Yeah.
That if one sheep is missing, like
No, that I
there's a
feel
problem.
what you're saying now is another misconception about nursing.
Okay.
Everybody believes nurses should be in the hospital wearing that uniform and that cape, carrying pan and serving medication. No. Can you see now? It is we have nursing is it's a very noble profession whereby you can actually wear your shoe and your suit, carrying your case, your briefcase. And when you start working, people will be like, "What are you working as?" You be like, "I'm a nurse." We have occupational nursing. We have a whole lot of branches of nursing. But the problem with Nigerians is that we do not read, we do not research. They just feel nurses are meant to give injection. If we ask your followers now, that's the only thing they believe nurses should do, which is very, very wrong. Do you understand?
Yes, ma'am.
Yeah.
So thank you so much once again for
Yeah.
coming on the show, and I want to thank our viewers for watching up to this moment.
Thank
Please
you.
and please, for it to go what we're doing here, please like, share, and subscribe. And if you have any question for our dear nurse here, you can drop it in the comment section
Yeah.
to get to reach to her.
You're a registered nurse. Bye.
See you in the next episode. Bye.